sure. Yes, there I am again. Let me see something. Nope, this is the way. All right. All right. It's Dr. Dawn, Chicago's own board certified OBGYN. I am here on Facebook and my Dr. Dawn page and on Instagram. So we're multitasking today. So if you are joining me, you are here. Hey, Corinne, thanks for joining. If you are here for the 5-day mini course. Yay, the 5-day mini course. We're on day 2. Hey, Kim, thanks for joining. We're on day 2. Woo woo, of the 5-day mini course. But again, it's Dr. Dawn, Chicago's on board certified OBGYN. My mission is to empower women of all ages with pertinent medical information and proactive reproductive health knowledge so that you can optimize your physical and your mental health. So I, right now, am focusing on teen health. I wrote a book maybe 3 years ago called The Clever Girl Life. Hey, Kimmy. And I decided this year, because the situations presented itself with COVID, to make a course out of this book. I got a lot of feedback from this book. People really enjoyed it and learned a lot from it. It's pretty simple. You can get it on my website. But from the book is where I am basing this mini course that we're doing today. So we have 5 days of the course. We're on day 2, and with day 2, we are talking about puberty. But first, let's go over what we went through yesterday. You guys were with me yesterday. We talked about the anatomy of women, of girls. And so we have internal structures here, external structures there, and we talked about all of them. So if you were not present yesterday, don't worry. The video is up on my Facebook page, Dr. Dawn Facebook page, and so you can go back and kind of review it, and so you'll be up to date with what we're doing today. But today, we are talking about puberty, ladies. Yes, puberty. For all of the moms or aunties or grandmas or cousins who have our young ladies living with us, we know that this can be angst provoking. And I'll tell you a little secret is the reason that I wrote this book is because I had a mom come in to me when I was practicing, and she was one of my patients. I had seen and worked with her for a number of things. And she came in one day and she was just so nervous. I could tell. I was like, well, what's going on? Did the fibroids come back? Because we had worked with each other for fibroids. So it turned out that she was just nervous. And she was just nervous about her daughter. Her daughter was starting puberty. She could see different things that are happening. And she just was really nervous and worried about what was going to be happening. And more importantly, how to discuss it with her daughter. So I wrote the book because I asked after her. I had a number of ladies that came in and they wanted me to see their daughters. They wanted me to talk to them, and doing that for some years, I kind of realized some things, and I knew that there were some basic things that our girls needed to know, and I also knew that there were some other things that we needed to know that weren't necessarily about medical history, but about how we carry ourselves. And so that's what the book is about. So today we're talking about puberty. Tomorrow we're going to go and dive deep into the menstrual cycle. But the day after that, we're going to be talking about self-confidence and how we can start fostering self-confidence in our young girls. And the last day is day 5 is going to be on body positivity. Again, after I've been doing this for quite some time, 17 years, not counting residency, but 17 years, and you get in contact with a lot of little girls, a lot of grown girls, a lot of women, young and old. And some of the themes that I have seen happening is that we need our girls to feel confident about themselves. We need them to be confident and comfortable in their own body, in their own skin. All of that impacts your health care, right? And it impacts how you take care of yourself. Everything from seeking out help when something's going on wrong or something is a little different, making sure you're exercising, making sure you're getting your sleep, basic health it all comes down to how much you care about yourself. And that is something that we as women have to start showing and teaching our young girls how to do. So that's kind of why I'm here. That's my mission. And right now, I'm really focusing on our teen girls. So, like I said, we are going to work on puberty today. If you have been following me, you know that I give out homework, right? Let me see if this is. There's my ticker. There it is. I'm telling you, getting all this technology together, it takes more than a notion. Another quick story I'm going to tell you, and then we're going to get down to puberty, is when Facebook Face first came out, my brother and sister had to set me up on it. I am, in the words of Erykah Badu, analog girl in a digital world. So I was not on Facebook. I wasn't on any of that stuff. And they were on and they were doing different things. And I said, well, what is the Facebook? What's going on with that? And they kind of roll their eyes and they're like, just give me your laptop, Dawn. We're just gonna set this up for you. And so that was years ago. We were in St. Louis. We were visiting my brother because he was graduating from law school. So that's how I got into Facebook. And so it takes me a while to learn these things, but I'm learning and I'm here and I'm ready to go. Thank you guys for joining. I've lived well with Rian and Griffin Art. The Griffin Art, he doesn't know. I recognize him from when back in the day when he was at the Evergreen Plaza. So I keep going off track. So we're going to get back on track. We're going to talk about puberty. So if you're looking here, if you go to this website, drdawnobgyn.com/clever girl 5-day, then you get on my list. And every day I give you a worksheet of kind of what we're going to be going through on today, on the day of the challenge. So on today, we have this worksheet that we're going to go through together. So what is puberty and when does it occur? So puberty is a time of normal sexual development for both girls and boys. It usually starts not necessarily with what you can visually see, but in terms of your brain giving off hormones and getting that body kind of geared up to start making some changes. It starts really about 8 or 9 years old. And in general, puberty is what is occurring that's getting our girls to stop looking and stop behaving like little girls, and their bodies are ready to be women and to be able to be sexually active and bear children. So that's what happens with puberty. If the body is getting our girls and our boys ready to be mature adults, and with that being able to bear children. And so some of the things that we see are pretty common. It just depends on when they're occurring with different people. So when I give you these ages, I'm really giving you on average, right? It's not something that you can kind of sit with your watch and say, okay, you should be here at this point. But this is the average age. And I always tell my ladies, pay attention to when you yourself or your sister went through puberty. And that's how you can kind of predict what's going to go on with your daughter. That's kind of something that you can look on and make a correlation with. So on our first page, we just had the basic definition. And I show you here what's going on in the body. All of this starts with your brain. So it starts with the hypothalamus and it starts with your pituitary glands. And basically those organs and that part of the body are part of the brain, and the pituitary start giving off hormones that stimulate our sexual organs and stimulate all of the body, right? So with young girls, one of the things we'll see is you'll have a breast bud. So before the breast is actually forming, you see just a little bud or mound of tissue is right under the areola. The areola can be a little pronounced, but it's just a bud, and that's your first sign that your daughter or your loved one, younger girl, is starting to go through puberty. And that the hormones will start going at about 8 years old, 8 to 9. So it may take a year for you to actually see the breast buds themselves, right? So once we get those breast buds, we also start noticing other things. The first thing you may notice, or your daughter might notice, is as she starts to get hair. The hair starts growing on different parts of her body that weren't really there before. So first thing we'll notice is she'll start getting hair on the labia. And like we talked about yesterday, the labia majora is the larger lips of the vagina. That's where she'll start seeing the hair. And it's usually kind of thin, sparse. And as she marches through puberty, she'll notice more of it. She'll notice it on her legs. That's when they first start noticing that. Again, they'll notice it under their arms. They'll notice it that during that time. And the guys, when they're going through puberty, they have those same areas, and then they'll start getting facial hair. So that's one of the things we'll see with our guys. When we are noticing them developing that hair, and you see the breast bud and they're marching through, you got to talk to them because they also start having a change in their body odor. So when it comes a little more pungent and a little more noticeable after they've done strenuous activity, maybe they've gone running, or they've done some type of exercise, as you're going through puberty, that's when you start getting those grown folks odors. So we have to talk to our girls and our young guys about using deodorant because that is a reflection of them going through menopause, not menopause, but puberty, and becoming more adult-like. So we talked about the breast buds, we talked about developing hair, and I tell you, ladies, if you are listening, drop me a line in the comments if you have questions, or you have a concern, specifically questions, or just to say hi. Just drop me a line in comments so I'll know, because I'm keeping my eye on that too, just to make sure we're covering everything. So we see the breast buds, we see the pubic hair. And again, I'm going through everything that's in our homework that I sent out to my ladies, so we can make sure that, hey, Alex, thanks for joining. We can make sure that everybody's on the same page, because everything I put in the homework is really what I think we need to focus on and what we need to know. So we have the breast buds, get the pubic hair, the hair under the armpits, hair on the legs, start developing body odor, start developing acne. So you might have a little bit or a lot, depending on your body chemistry, where that's one of the things that people will, girls and guys will see, is acne. So the acne and the body odor, we know that your child is becoming more of adult than a kid. Now, the other thing that we start seeing is a growth spurt. We see it for the girls and we see it for the guys, but we initially will start seeing it during this time. A lot of times you won't necessarily see it, but when these hormones are all kind of going through, that's when you can assume that that growth spurt is coming pretty soon. All right. And then the final thing we start seeing is you get more curvy with the girls. The breasts are continuing to get larger. You start having hips and thighs and more of buttocks. And again, this is just our girls starting to look more so like women as opposed to young girls. And that's where they see increased fat deposit in those areas that I just talked about. So all this starts, like I said, the hormones start at about 8 to 9. You start seeing these changes starting about physical changes. You'll start seeing those about 10 years old. And then so at about 13 years old, 13, 14 is when we will see breasts are pretty much where they're going to be. And 13, 14 is when you probably will notice your young girl having her first menstrual cycle. And so again, I tell ladies, kind of try to remember when you had your first cycle. And that's going to give you a blueprint rather, of when to anticipate when your daughter is going to have hers. So for the growth spurt, you're going to notice that growth spurt actually before the menstrual cycle, right? When that girl starts having her menstrual cycle, that's when you can assume that growth spurt for the girls is going to start slowing down. So you have your growth spurt, then they have their menstrual cycle, and you can see that growth spurt and their height kind of decreases. So the final phase, and again, I'm going through a homework because we want to make sure everybody is on the same page. They're starting now, they're having cycles. They may not be regular though. So you may have a cycle, you may not have another cycle for another couple of months, or you may notice that you have it a week or so, 3 weeks later. Most of us are kind of used to, or we're familiar with the 4-week or every month when we'll get our menstrual cycle. Well, that doesn't happen right off the bat. Initially, it can be really irregular, and that can happen for 6 months, a year, year and a half. it really can take the body time for it to regulate itself and have a regular cycle, because those hormones that are getting given off by the hypothalamus in the brain and also by the pituitary, it has to kind of mature. So it does it, and then it kind of has to get into the routine of getting those hormones off on a regular basis. And so your body is reacting to that as well. And so it takes a while for our cycles to be regular for the girls. Um, so last stage, 14, 15, you can anticipate the girls have started their menstrual cycle, the breasts have slowed down with the growth, their height has slowed down as well. You will definitely see a full-fledged with the body hair that's under their arms, that's on their legs, in the vaginal area. And you'll notice the things like body odor and acne going on. So typically, like I said, 10 to 14 is when this is all occurring. The hormones start usually around age 8-ish. You won't see anything necessarily. And 9 is when everything starts kind of marching from there. By the time a girl is about 15, which is usually, I would say, first year in high school, that's when things should be kind of squaring away. She should be getting regular cycles, or at least she's had her cycle, and she should be kind of where she is with the height and getting familiar with things that are going on as for a younger lady. So that is really it. If you have any questions, just drop me a message in the comments. I am looking here in for Instagram and Facebook. Right now, I don't see any. So what I will say is, let's say you have questions that you'd like to talk to me about. What I'm going to do is I'm going to hang out in my group. I have the Courageous Clever Girl group. It used to be the Clever Girl crew, but it's the Courageous Clever Girl crew group. And it's on my ticker. So it's Dr. If you go to Dr. Dawn OBGYN, .com/Clever Girl Crew, that's going to actually get you to in the group. I'll be in the group myself, and I'll be looking for people. I have to allow you to come in, but if you come in now, or even if you come in after this broadcast, I'll be able to go through and click you in. Because a lot of times what I'll do is I'll put in things that I'm going to be doing in the future. After these broadcasts, I'm going to go in and sit for a little bit, because if you have a question, maybe you weren't comfortable with asking me kind of right at the time of the broadcast, you can go into my Facebook group and we can ask questions and kind of make sure that everybody's on the same page. But it's pretty basic with puberty that we're talking about with our girls. So I am going to wrap it up for now. I do invite you to join me tomorrow, same time. We're going to start about 6 o'clock. And tomorrow we're going to be talking about the menstrual cycle. And I think that's important for us as women and for young girls to understand, because a lot's going on with that menstrual cycle. And it'll help you to understand what's going on with your body. Even if you're not actually on that last week of bleeding, there's some things that you can anticipate that are going to happen because you're at a certain spot with your menstrual cycle. And it's really good to kind of understand that, so you have a better idea of what's going on and really won't be worried when there's something that's normal happening and you may not know it's normal. So again, tomorrow we're going to talk about the menstrual cycle. We're going to go in depth with that. Come with your questions. It would be really good if you all could sign up. That way you can kind of get the homework here and this stuff. You know, every day I'm giving you information. So by the end of the week, you'll have a good amount of information that you'll have that you can fall back on and be knowledgeable about. So the way to get the homework and know what's happening, Dr. Dawn OBGYN /Clever Girl 5-day. And that's going to get you on my list. So I will be able to get you the homework in advance. And when I'm going through with the lecture, you can kind of go through with me and kind of follow along. So that is it. I am going to go into my Facebook group, the Courageous Clever Girls, for the next 10 or so minutes. So if you have any questions, join me there. If not, join me tomorrow. We're going to be here tomorrow, 6 p.m. Central Standard Time, because I'm from Chicago, so I'm on Central Standard Time. Join me tomorrow, 6 o'clock. We're going to be going over the menstrual cycle. And hopefully I will see you all there. All right, see you later.